So normally Dr. K would be here,
Normally.
but she messaged me. She was hoping to be right on time. Procedure may have run a little late. So what I'm going to do, I will stop sharing this screen.
You want to just start with a topic?
Yeah. We'll throw it out to y'all if there's a, I know we had a great discussion yesterday. We skimmed the surface on a lot of different topics, but if there's anything in particular that anyone would want to start the conversation with today, we can dive right in.
Yeah, I wasn't able to be on yesterday as I was teaching, but was there a place where you left off, or was there a topic that didn't get to be fully realized? Really? Really?
We actually went overtime.
Oh,
I cut it off a couple minutes, but
we spent the majority of the time talking about the ACA field guide for 2021. We didn't dive into that, but there was a lot of conversation surrounding that, and kind of for there to be ongoing sessions or chats for people to kind of go through that together and be able to come up with plans for next year. And then there was just a couple of topics not related to COVID that kind of came up, but it was pretty informal, and it was kind of like this, where it was a little slow getting going. But.
okay.
You actually had things to talk about besides COVID? I mean, come on.
Marijuana came up since it became legal in many states, both medically and recreationally. So it came up, but very briefly. That was kind of the extent of, there's some policies that may need to be looked at, and utilizing volunteers and medical staff and such in a way to kind of help with those policy reviews.
Good. I know CBD oil came up at our last time we were face-to-face in camp. And that was something we had to take a quick look at. So yeah, definitely a topic that needs to be investigated a little bit more, and it's going to be statewide. It's going to be state to state.
And now I'll throw this out to y'all as a question, because I'm obviously not a medical person. Though I do, because of all of you, I've learned tremendous amounts of.
You're an adopted member.
I kind of am. I feel like I am.
Yeah, you are.
So my question is, and it has to do with, I guess, the CBD oil and both recreational and medical marijuana. So New Jersey just passed it as well this year. But a lot of our kids come from not just New Jersey, but Delaware, Pennsylvania, New York. So has anyone had experience with where kids coming from other states where it's legal in that state but not in their current state, or vice versa, that they had to figure?
There was a really good presentation, wasn't it, last year? And I think it was somebody from the Canby Nurses Association that gave it. And nurses with their licensure, even if it's legal in their state, cannot legally administer it. So, you know, I came out of that session thinking that it would be difficult to allow medical marijuana even in a state that's legal at camp, the camp setting. You know, in the hospital, the parents have to be the ones administering it. Isn't that correct, Mary Ellen? I see you shaking your head. Did you come out of that session with the same?
Yeah, I think, didn't Tracy do that? Did Tracy do that one from
Maybe.
ACN?
Maybe it was Tracy.
Yeah. Yeah, I think she did this combination of hot topics in camping, and that was definitely one of them.
Yeah.
And we serve a national population. Medical marijuana was legal in Montana and just became legal recreationally. But one of the things that I had taken away, I don't know if it was from that same one that you guys are talking about, because I feel like this was actually maybe even a year and a half, 2 years ago. So it might have come up at like a regional. I really dove into our state law because that was kind of the big suggestion that I had. And the fact that it's not legal nationally means that it can't cross state lines.
Mhm.
But then you have to look at it from within your state about whether or not your state is a reciprocal state, about recognizing medical marijuana cards from other states and such. And it was really, really complicated. And so we have all age groups. So we have kids, but we also have adults. So we just, since it can't cross state lines, we just opted and said, it's not allowed here.
I think that's the safest thing to do.
Yeah. We have the same thing that we take kids nationally, and the camp is in Virginia, but the medical care is provided through the National Institutes of Health. So that's a federal agency. And so we're not, unless it's federally legal, we're not allowed to even talk about it or deal with it. So it's so complicated. And it's especially for CBD oil that has theoretically no, THC in it. It is so complicated and such a big deal that we just opted, we can't do it.
I can speak on that a little bit. My name's Kelly and I am from Camp Good Times, which is in Vancouver, British Columbia. So we know all about these sorts of things. So in Canada, marijuana is legal throughout the whole country. And we run into this a lot. And I think our position at this point may be similar to some of you in the hospital, is that we recognize that people are taking it and we don't encourage it. We don't promote it in any way, CBD oil or marijuana. But we recognize that it's happening just as other complementary medicines are taking place, right? So our position is just that we're hands off. If you're taking it, you're administering it, and you are doing everything that needs to be done around that. And we are not responsible in any way for anything that's going to happen, but we do have to know who's taking it. We do have to know who's using what and when, and they even have to come in and sort of sign in like, yes, I just went and took some CBD oil just in case, to monitor for side effects and things like that. And we have a kids camp, but we also have family camps. So parents come as well. And some parents do have like legal, like a doctor's legal order to smoke marijuana. So that becomes more tricky because how do they do that on site? So the times that I've seen it happen, we just have to find a place that's sort of far away from everybody else where nobody can see it happening, and sort of in a discreet way. And the marijuana has to stay in the med shed, as we call it, with like locked up, and they come and get it when they need it. And then they go use it and come back and leave it there locked up as well. I mean, it's all very complicated, but we would rather know what's going on than not know. And at this point, we just say, we understand that you're doing it. And, here we are to help if anything happens, but it's not really our responsibility.
So Kelly, that was going to be my question. If somebody is using that, you don't want them to have it in their cabins with other kids, right? So they bring it to the med lodge and you keep it locked up, and then they come get it when they need it. Or want it.
Yeah. And it's a bit like, say if it's an adult for family camp and they're using it, it's not exactly like just, use it whenever you want all day long. It's sort of like set times that we sort of create kind of a care plan. Like, okay, so you usually use it 4 times a day. So you'll come at these times and use it and then bring it back to us. And then that's it. So it's not just, walking around camp smoking marijuana.
Interesting.
Interesting enough, even though we're in Vancouver and lots of people smoke marijuana, it actually hasn't come up that often. CBD oil, yes, a lot with the kids for sure, but actual smoking marijuana hasn't been very common at all.
Perfect. On that note, I'm actually going to introduce our speaker today. She's arrived. So I'm
Hi,
delighted
everyone.
to introduce Dr. K, who is the medical director and camp doctor for Camp Bring It On, as well as the president-elect for COCA. So welcome, Dr. K.
Hi, everyone. My apologies. The weather we've had wreaked havoc on our schedule, so our procedure started late, and then Zoom decided I shouldn't join the meeting for a while. So my apologies, but I knew you guys would start talking because we're all good at that. So Kelly, I was gonna just ask, do you have staff that use it? If you've got like a survivor or someone who comes back to camp, what's your policy as far as staff using marijuana or anyone else?
As far as I know, we don't have a policy. I don't think that we've ever had that situation before, but that's a really good question because it could potentially come up. I haven't seen
wonder-
that happen.
I wonder as our campers graduate and come back to be volunteers and staff, if it's
Mhm.
something that's on their long-term pain management plan, that type of thing. We
Mhm.
probably are gonna have to address it, but then you bring up if they're potentially impaired,
Mhm.
but is
Exactly.
it any different than someone who's on narcotic pain medication, you know, and how do you address that? So,
Mhm.
But even that, I think, is a good question because we had an episode, our last in-person camp, where our lodge dean had an anxiety attack and she had a prescription for an anxiolytic and she took it, but I guess she took two and it zonked her out. And we had to, somebody came and said, she can't function right now. And so that was a horrible situation because we had to go down there and find somebody else to be in charge and put the backup plan and it created a lot of havoc. And so that raises the question of any kind of drug. Granted, they might need it, but if they're impaired, their responsibility is to be caring for children.
Right.
And if they're not able to do that, we've had to look at that because we've had other instances where the counselors are survivors who have been on narcotics, and there's times we just put them we don't put them in a room with kids. We put them in some other kind of program role because we don't want to take that risk.
and it's one thing if they're employees, that may be, from that situation, but if you're dealing with volunteers, that changes your expectations that you can ask as well. Because I was thinking, well, potentially I could use our rules. I'm obviously like our nursing staff can't be impaired at work. We could use that. But again, I am dealing in a situation where most of my staff are employed or the nurses that come are at the courtesy of the hospital that owns us. So it's a little different situation in that very unique scenario. But
Yeah.
volunteers are a whole different challenge.
Yeah.
Especially when we've all talked about how difficult it is to get medical staff and medical volunteers. If it were to happen to be someone in that situation, that also adds another flavor. So, okay. Other thoughts people have about dealing with marijuana, CBD? Did you guys, again, apologies for being late. Did you talk at all about edibles and how you deal with that at camp? Okay. I think that's another thing that's potentially been brought up as a challenge too. I mean, I guess maybe a simple answer is, well, we don't let campers bring outside food. So we go away that way. But if it's considered to be a core part of their nausea management or something, I think that may be distressing for some families.
Yeah.
If it's something that patients use. I would struggle with that, not knowing how much is in there, how much they're eating at a time. Again, keeping track of where the edible is stored. So it sounds like we have a lot of things to address when we start our core group of working on policies that came up last night as a request. And Matt, did we talk about this at all yet from the session from last night?
Briefly.
Okay.
Yeah, it did come up.
Hopefully I know that COVID will be on the front of everybody's minds, but I think as we discussed already, it's not the only thing we have to address. So we need to get some working groups together and really try to make sure that we're doing as much as we can for each other to navigate these challenges. So, okay. Other topics people have on their mind or wanted to throw out? I know that this is something we revisit every once in a while, but again, it's going to come up with COVID. What do people do as far as your immunization requirements for campers? Do you say yes? Is there a list that you require? And again, how does that maybe inform the COVID vaccine if it's available type thing? Thoughts anyone's had on that yet? I have been told that I'm allowed to say you have to be immunized unless you're not allowed to because of treatment. Now, we have not addressed the COVID question, and because that vaccine isn't available yet, but at least for right now, I just say if you've chosen not to get vaccinated when you've been medically cleared to do it, then you're not going to be allowed to come to camp. You're allowed to make that decision. That's a consequence of your decision for our camp.
Yeah, that's what we did the last in-person year, because that was when the measles was really perking up. And so we did say that. We said, you know, I think we lost maybe 2 counselor volunteers out of that who were from a family who didn't vaccinate. And we just told them, this is our requirement. You've made a choice. And so your choice is impacting your ability to come to camp. But we felt like we had to make that decision and say, unless you're medically unable to get vaccinated, you must be vaccinated. So we haven't talked about COVID yet, as you said, because we don't know what it's going to look like if you have to have 2 vaccines or if you have to have 1. And so I guess we'll cross that bridge when we get to it. But it's kind of like swine flu, you know, when we had the couple of years ago, or 10 years ago, probably, when we had swine flu, you know, there was the H1N1. Do we make sure that people are vaccinated for H1N1? At that time, we didn't require it for everybody, but we did do, you know, heightened surveillance at camp. So before everybody got on the bus, everybody had to get temperature checks and, you know, and history of what had happened in the last 3 days, et cetera. So I assume it'll be something similar to that.
I wanted to ask a question, and I apologize, I wasn't able to do the roundtable yesterday, so this might have been talked about, but looking at 2021 and planning for in-person, so, you know, kind of trying to think through what immunization records, but also has anybody come across a good system? I was hoping to find something where our parents could just basically 2 weeks before camp start logging in every day with a temperature check and any kind of symptom tracking, some kind of like tracking up until camp, so we can see how does that make sense? Has anybody found a system or program that kind of offers that or makes that easy to integrate for the parents?
Erin, who do you use for your applications?
So we actually just started using Camp Doc last summer, but I know they have it, but I'm moving away from
away.
I don't like the system at all. And it was like going to be our first summer using it in 2020. And then of course we didn't have to end up doing it, but that gave me enough of like, we should probably find something is a little bit friendlier for our families. So I know that was something they tried to pull me in with, was they have that set up. So, but the rest of the system, I don't know that it makes it worth it.
I know.
I hadn't even considered it yet, Erin. So
okay,
I'm curious to see what others here think.
I've seen some of our employees have kids who were in-person school, and they had to do that for their private school. I was thinking they did it through Google Doc, but then everybody could see it, so maybe it wasn't. But it was something that they had to log in and do every night for 14 days prior. At Camp Twin Lakes, the camp facility that we use, they started doing in-person camping weekend programs, and they just have the people bring that sheet with the 14-day log with them to camp, and they look at that sheet and do the temperature check and ask the questions before they get out of the car. So rather than upload it to something ahead of time.
Right. And that I guess my thinking was, and that's what we were thinking about doing, Sally. And then I was like, well, it'd be really nice if we could kind of know ahead of time, and then be able to save a trip if, like, you know, oh, well, Joey doesn't, I don't know. I'm just trying to think of a way to make checking
I do know they did that for the school, but whether it was a Google Doc or something else, I don't know. I'll find out.
Appreciate it.
Yeah, your point is very valid, Erin. It would be nice to know it in advance, because it's going to be much easier to say, oh, based on your temp a couple days ago, you can't come, than turning away that little face at the door, at the gate. Yeah. Parents have driven 2 hours and they're packed, and
I'm powerless in front of the child. So I need it to like not happen where they can see me. So, all right. I appreciate that. Thanks, guys.
And Erin, I don't know if any of these are any good, but I just did a quick search in the App Store on my phone, and there's a ton of COVID-19 related apps. So it, you know, whether or not they're going to actually do what you're after and how you would get the results from multiple people. I don't know. So I don't know if that's an option, but there's a lot of stuff in here. For
Yeah.
COVID-19.
And I knew that, and I know that. So I think that there's probably a unicorn out there, but I was like hoping somebody else had already found it. But I'll sift through. I'll be the unicorn.
We
Well,
haven't
it'll be something we
officially,
keep on our list to talk about in our sessions that we're going to set up.
Perfect.
to say, we haven't officially like kept a list of anything, but we do like send a letter to the parents the week before camp that says, in the 72 hours before camp, you must notify us if your child has had any of these symptoms. And so, you know, I think everybody probably does something similar to that. But for the most part, I feel like parents have been pretty responsive, because I get a lot of phone calls for stuff that is irrelevant, doesn't matter, but they're being earnest about calling because they know they want their kid to go to camp. So
Thank you.
Other questions people wanted to talk about or bring up?
is there anybody on here that has done in person? I've been hearing smatterings of people who have done some in-person at camp activities, even if it's just like a day camp, and I'm curious how that worked. I'm a little skeptical just because I work at NIH, so we're following all the rules hardcore. So I'm envious of people that are getting to do stuff like that, but I'm just wondering how that's pulled off. Has anybody done anything?
No, we haven't done anything.
We did one in-person program, but it wasn't a camp program. We did family photos, and it was a drive-in. So they'd come in their car, you know, they'd wait till it was their session, have the mask, it was all outside. Photographers were distanced, and their family got these great professional photographs, but it was at the Camp Sunshine House. So that's the only thing we've had in person. But as I mentioned, I think earlier, the camp facility, Camp Twin Lakes, that we use has been having in-person family camps with other groups, children with diabetes, type 1 diabetes, and some developmental disabilities, but none of our group. No immunosuppressed kids, really. So, but their camps, they're following the ACA guidelines. They do the checks beforehand. They do the checks when they arrive, have to wear a mask. The families travel in their own units and do all their activities together in their own units. The meals are distanced. Everything's outside or open air. It's very different. So,
Thanks.
but it's being done, and they've had success with it without any outbreaks.
Good to hear.
Hi, my name is Mackenzie. I'm from Camp Kindle in Alberta. So throughout the summer, we didn't run overnight residential camps, given that they're not, I think they're scheduled for phase 4, which is in 2022. But we have been able to host individual families out at camp for a weekend. So over the course of 3 days, we have an individual family come out and they have their own private lodging. Before and after each family stay, we have a cleaning company come out and clean and disinfect everything. And then all of our protocols were reviewed by an Alberta Health Services health inspector. And so while we weren't able to host the same amount of families as we would have in the course of a summer, I think we had about 45 families total. So it was really nice to have some people use our site and our services. In addition, we did do one family aid program. So we had about 15 families or 60 people total come out, spread out outdoors on our site. And we just did everything physically distanced with masks while it was outdoors. And then there were about 12 activity stations, and families moved as a unit. And then in between each group, everything was disinfected, or we had other supplies that we rotated in. But it seemed to work well our screening was pretty smooth. I think it was just something families have come to expect. And then we were careful to follow up with families in the 2 weeks following the event to ensure that nobody developed symptoms. And if they were to develop symptoms, we could do contact tracing, but it seemed to go pretty smoothly.
That's great. Thanks, Mackenzie.
Congratulations, that's impressive.
Yeah.
What kind of activities did you have them do?
We had, our camp team was really creative, but we had like a giant snakes and ladders outdoors. So we got like spray paint for the grass and mapped out like the board. And then we had like a giant dice that families would just kick instead of touching it with their hands. There was also, it was in early October, so we did pumpkin carving as well. And then there was a scavenger hunt, frisbee golf, archery, boat racing. There's like a little creek out at our camp. And then a couple craft stations, and then we had a photographer out and they did individual family portraits on site as well. It was good.
That sounds like a lot of fun things to do even in regular camp. So I'm curious to know ways that people engage their medical staff in the camp activities that you did this year, and how do you want to continue to keep us involved if unfortunately we're virtual again this next summer? Be curious to see what people did.
Well, we did a lot of, I have to give total kudos and shout out to you guys for running the town halls, because that made a huge difference for me as the medical coordinator to figure out ways to get my med staff involved. And so we didn't have as much involvement the week of camp because I think all of them, you know, it's so hard for them to get days off that when it was virtual, they didn't take days off for that. And there's, you know, a lot of the managers are like, we're not going to give you days off for our virtual camp. So when, especially when you don't really need med staff during virtual camp.
Right.
So they were able to log in and participate whenever they could get a break, or whenever they, you know, for nighttime campfires and stuff like that. So we did have people logging in throughout the time, but most of their stuff was ahead of time. So we got them, we had a day that all of us, a large group of us all went out to our campsite and did the virtual backgrounds that I have here. We decorated lodge rooms and took photos of them so that the kids could upload a virtual background and pretend like they were in their lodge. And so we just, and they, you know, it was great for us mentally. So we did some videos. We did like a silly check-in video, camper check-in with the camp doc and myself, with checking in the gorilla and an alien camper and a unicorn camper, and, you know, just silly stuff. And we did Medline, where a kid barfed all over the, you know, we had this alien barfing all over the camp director, and, you know, so it was just trying to do silly stuff. And so we would, while we had mostly a live camp, we would start off the day showing these little vignettes and videos. And then the med staff did a series of infomercials, kind of like commercials. So we would have a session and it'd be, and now a word from med staff. And so we would do things like silly stuff. Like we had a whole video about how to wash your hands properly using glitter and lotion, so that you could show how the germs, how much it takes to get the germs off. And we did it in like warp speed and then slowed it down and just tried to make it silly into good music. And then we did one thing with we had all the med staff send in a picture of how to wear your mask properly, but then also wearing it super silly, like on the back of your head, on your face. And we just did a montage of that and put it to Benny Hill music. So it was going like super fast and stuff, and just showed little vignettes of the faces of med staff. And, you know, just did those kinds of things so that the kids would see their faces of their favorite nurses. The nurses, in prepping it, had a great day and felt like they really were a part of things, even if they couldn't be there for camp. So that was just a few of the things that we did. And then we also did a postcard campaign. So we had med staff writing postcards to the kids so that every kid got a card every day at camp in the mail. So the people love that because they got to, we tried to do it to, the spreadsheet was like obnoxious, but trying to figure out what kid had what nurse the year before so that that nurse could write a personal note to them. And just every day they would expect to get something during mail call. So
Very cool.
a lot of prep, but it really helped keep people engaged because they were just as depressed about not having camp as everybody else. So
Yeah.
We did a couple of things. Our med staff was able to put a little gift inside everybody's Camp in a Box. And it was kind of gave a list of how to keep safe, how to stay safe during these times. We sent a postcard picture of our medical staff and also a couple games and, fun things they could do as a family. And then for some reason, and maybe there's others out there, for some reason, our camp is incredibly into tutus. And so 2 of our doctors did a tutorial, which was amazing. They did a great job and the kids loved it. So they got a chance to see them and interact with them via Zoom. They had a great time.
It was hysterical.
It was
It
wonderful.
was absolutely hysterical.
Dr. Dorothy and Dr. Trisha were rock stars. They rocked it.
We learned so much about our docs that session than I think we ever have before.
We did. It
Like-
was
So you have
awesome.
to tell us what's the history behind the tutus, or how did that become a thing?
I don't even know. Katie, it was probably you.
Probably Katie.
Probably Katie.
Okay.
It was. She wrote it was.
You know what it was, yeah. All right.
Yeah.
Well,
And if anyone is near Delaware and was short on the tool during the month of July, it's all because it's at Dr. Dorothy's house.
It is.
Found out that she hoards tool.
She does.
okay.
There's support groups out there for her, but
Mhm.
it's okay. We're working on it.
Any other activities that people did with and got their med staff involved?
For us, our med staff, actually, there was a few of our nurses, Kelly and Marty, that actually helped pack all of our 100+ boxes to go out. So we made sure that we took pictures. So those were posted all over our social media for the kids to see. And then our nurses were invited to every session that they could attend. And we actually had one of our nurses ran a session for each of our age groups. It was part of a scavenger hunt. So that was his way of still staying connected with the kids during the week. So we built it based on what his work schedule was. We built his sessions around that so that he could run them for the kids.
Nice. Did anyone have an opportunity? I'm trying to ask, was this a way that any medical staff that maybe had never been part of camp before got to be involved? Did anyone have that come up? Okay. I was just curious, sometimes when there's more opportunities, people can't leave for vacation or something like that. Sometimes this is a chance to introduce coworkers to something they wouldn't try in person, but.
We did one thing with our staff. Flag raising is always a big part of our tradition. And since every morning and since we weren't at camp, we videotaped flag raising at different locations around Atlanta. And we did one at the hospital. And so a lot of the doctors and nurses and medical staff that would normally be at camp came out and did that flag raising for us at the hospital. So that was kind of their way of being at camp, because most of them were not able to get the time off or much time off just because of the hospital coverage. They were stingy at getting time off.
Yeah.
So.
We were actually able to have some newer people that had not participated before be a part of different sessions as kind of leaders or moderators or whatever for the different groups. And then a lot of our medical staff helped with, like you'd mentioned before, with packing the camp in a box and then doing the parade. And then we used them also at that time to do temperature checks and just kind of normal medical stuff, but a lot of really fun kind of new experiences for them, which I think kind of reignited the fire for coming years too, which was really fun.
That's cool, because I had trouble. I mean, I didn't really put out a lot of recruitment because we didn't know if we were going to have camp or not. And so I wasn't able to get any new people, but it was good for the people who loved to come to camp who weren't going to be able to come to camp that year to get to participate in some of these activities and stuff. So it did still help with recruitment, but I love the new people. I think part of it was me. I didn't really recruit because I thought, what am I going to tell these people? They've never been to camp and now they're going to just get online. So it's nice to see that it worked, and that's cool. Make me try a little harder next time.
Jen from Make a Dream had posted that they had some of their favorite nurses lead a workshop on nutrition and made smoothies and cookies and that type of thing too. So another way to get maybe med staff involved. On a different question that just occurred to me, and I meant to ask last night too, are any of you involved in in-hospital programming or the more non-traditional camp programming, and how does that look for yourself or for your medical staff?
Yeah, we did a lot of in-hospital programming, or did, and so of course they're not letting any outside people in. We're delivering activities and things like that. Actually, we got approval this week to allow one person to go one day a week, not to have any interface with the patients, but to help put flyers out and packages of activities out, and just really to help the child life staff so the burden's not on them. So maybe there's light that will, continue, that there'll be a day when we can actually go to the kids' room and run activities in the playroom. But we were doing that 4 days a week.
So pre-pandemic, was your medical staff involved in those programs at all?
No, not involved. They were aware of them. They helped us. We did some evaluations, and the nurses helped us with the evaluations, but mainly the interaction was with the child life staff. Our contact.
Sure. Anybody else that did this pre-COVID? Did you have medical staff involved, or is it more informal just with the kids in the building?
It was pretty much just our program staff that did it. They are the ones that run the programs. But I think going forward, it would be nice to be involved with it now that we know that, we had several kids who participated in virtual camp from the hospital. As I mentioned in my presentation the other day, we had one kid from the PICU who was, participating in camp from the PICU. So it does open up some opportunities, and it might be good for med staff to be able to be involved with, helping program staff to know what are some of the things they need to be concerned about when they're dealing with a more in-hospital, more patient specific, rather than just like some of our programs, they go to the waiting room and they hang out in the clinic. But really going into the inpatient units and providing some guidance to them would probably be the best role, I guess. But I could see us being involved in the future. It would be nice.
Sure. Has anyone thought, again, when we all get hopefully back to normal and have in-person camp, now that we know we can do things virtually, has anyone thought about a hybrid where maybe a kid who got stuck in the hospital with a fever and had to miss camp could still participate? I honestly hadn't thought a lot of these things, but some of the discussion we're having is kind of making that come up to my mind. So I was curious if anyone else has thought of that yet.
Yeah, we at Happy Times, our centers that are the majority of our kids come from treat both oncology and hematology, but our camp is only for oncology. So because we went virtual, we were able to open up our camp to include our hematology patients as well as our siblings. And because the program was so well received, the board asked if we would run a second program, strictly virtual, for our hematology and siblings. So of course we said yes. And then we're looking into incorporating some type of virtual aspect to our oncology camp. For that reason that you said, Dr. K, because we have a lot of kids that at the last minute can't come because they need to stay in the hospital.
Sure.
We definitely talked about doing a hybrid. I mean, once we saw the benefit of some of the things that we did virtual, we said, this is crazy. Why didn't we do this before? And one of the things, it's not medically related, but one of the things that we realized was for the talent show. I don't know about y'all's talent show, but our talent shows go on endlessly. And so it was really nice because the kids sent in video clips of their talent and we showed them together. So we're like, this is a way we could do this for the kids that are shyer and won't get up on stage, but would just like rock out at home in front of their parents, that we could potentially do that. So we thought maybe we could make it like a hybrid talent show where we do some video and some live, and maybe it would help speed things along too. But being able to, we haven't figured out, I mean, I think that's going to be the discussion for town halls. If you guys want to, if we have to do this again next year, how to incorporate virtual with live, because I think, I'm not sure how you do that to make it an equal experience for the kids that are in the hospital and live, especially when you have poor internet access at camp sometimes.
Yeah.
So I think there's a lot that needs to be worked out with that, but we all definitely felt like, okay, we need to look into this and figure out a way to definitely incorporate the kids that are in the hospital to camp next year.
Sure. Okay.
I can
We
say
have
here,
partnered. Oh,
you can go ahead. No. I can say here in Vancouver, we've already had to put in our proposals for next year, unfortunately. So we've had to make some decisions. So for next summer, we're already planning that we will do a very hybrid. So we provide kids camp and also family camps. So the site that we do it on, which we rent and we don't own, the site that we do it on this summer, they continued to run with other programs, some other programs, and they did it pretty successfully. So next summer, we've decided that we are going to do a program that's similar to like a family program where families come and they have their own accommodation. And this year, what we're planning is they are going to do just individual family activities and move around the site as families and not actually really interact with the other families. And we're going to have a much decreased capacity. So we've decided that, but then on top of that, we're going to continue doing virtual programming for anyone else that won't be involved. So where we thought it would be less work, it's actually going to be more work. So we will continue with that virtual programming and we definitely did see a lot more participants that were, say, in the hospital or, wouldn't have otherwise been able to come to camp that got involved. So I think going forward, it will for us be trying to figure out how we can do sort of both sets of programming as well.
we partnered a lot with our child life specialist, and so we've been really having more of a relationship with them than say that the doctors in our community aren't overwhelmingly supportive of sending their kids to our camp. So we've kind of tried to work around that. But we had a really successful virtual program, and we made a YouTube channel so kids that couldn't be on session because of timing or procedures or other family activities could access that later. And then the child life specialist also has been using that on her iPad when she meets with kids since camp, just to show them videos or funny skits instead of like whatever else they're showing them. So that's been kind of a fun way to connect still from, camp into the fall and into the winter. And then we donated our excess supplies from our virtual camp in a box to the child life specialist so they could hand them out afterwards, games and books and stuff like that. So it's been kind of a good connection going forward.
And I'm sure much appreciated, since no one can go to the playroom or their usual resources to have more things to do in their room, was hugely appreciated.
Yeah. And then I did struggle to get involvement from the rest of our nursing staff. We held our virtual camp in June, and I'm in Washington State, and a lot of our nurses weren't even living in their own homes, just quarantining. So people are maxed out. So we
took some of we had done some gifts for parents. And so we used those also for nursing staff. We just delivered them to the hospital, coffee mugs and coffee cards and camp t-shirts. Since nobody could be coming to camp, we delivered them all to the medical staff also, just as kind of like little care packages, because I'm a nurse and I don't work in the hospital anymore, but my heart just hurts for everyone that it is. So just trying to take care of the medical community that supports us in the camp season.
That's a great idea. Coffee and a shirt to wear under your scrubs. We all love that, right?
Exactly. Just an extra shirt. You never know if you need one in your locker. Might as well put on a camp shirt.
Right. Okay. Alicia, I noticed you had posted about your medical staff making candy sushi and dressing up like the Swedish chef. I would love to see pictures of that. Okay. All right. Other comments, questions people wanted to talk about?
This is Elise. I will definitely try to send some pictures. And we too had a lot of success with the medical staff, heavy medical staff come in that, you know, usually weren't even a part of or weren't able to actively come out to camp. So it just all worked out. And it was so nice to have them as one of the rotations. So, you know, they had to put everything all together, and it's just nice to see everybody just be able to be so flexible and to change things up so drastically. Just very proud of my medical crew, you know, and very creative.
Very cool. Something else I wanted to ask, because this has come up a few times, again, assuming, you know, in-person camp, and if we get back to that world, when we get back to that world, what do people do as far as having your medical staff participate in activities at camp? Or are they more likely to stay in a medical hut? How do people approach that? I'm curious, just to get a feel for what everyone's doing.
We have at least one medical person kind of in the health center at all times, but the others are welcome to go and be visible at the activities. So if they want to go and support in the art barn, or when they're doing the zip line or anything like that, they're welcome to go and be part of that. And occasionally we have our medical staff be judges for different things. So we do a phantom white glove, which is a cleanliness contest, where the cleanest cabin gets to win the golden plunger and the dirtiest cabin gets the dirty sock. And our medical staff is our phantom white glove, and somehow or another that's managed to stay a secret that nobody seems to know that. So because they can check the cabins when they go to deliver meds and such. So they have like natural reasons to be in the cabins. And the kids will write poems to the phantom white glove and like try to bribe them and leave candy and stuff like that. And the phantom white glove always responds in poem as well. So our medical staff gets to be a big part of the phantom white glove throughout the week.
I get to do that at camp. The kids know it. They also know I accept bribes. It doesn't always work, but I will accept them. So
We actually assign our med staff to activities. So we tell them, you know, here are the activities, give us your top 3 that you want to participate in. Because some people like absolutely hate horses and don't want to be there. And other people, you know, hate water sports or whatever. So we try very hard to let them do that, but we try to give them consistency so that they get to be part of the group and hang out with the kids for the week and go through the progress of the class. So that has worked pretty well. It's a logistical nightmare sometimes, but it does seem to work pretty well. And that way we started off, when I first came to camp, it was med staff and program staff. So we've worked really hard to kind of go, we're all one team. And so we've had the med staff try to incorporate a little bit more, but we also have to tell them not to the point where you lose sight of the big picture, because you're there to be the oversight for safety and monitoring. So we want them to be involved, but not so involved that they're making their craft and not paying attention to what's going on elsewhere. But they really like that.
other folks?
I can chime in. I'm sorry I was late. The system just didn't want to let me in this morning. It took a long time before I could get that magical verification code.
It wasn't just you, Mike. Zoom didn't want me on either. So welcome to the club.
Anyway, we encourage our medical staff to be very involved with the campers while making sure that there is a core group at the health center who can deal with any issues that come up. We also encourage the program staff to involve, like if a cabin group is planning a scavenger hunt, then one of the stops is likely to be at the health center, and their task will be to sing a song to them, or the med staff may have a riddle for them to solve or something like that. So we try to both have the kids go to them and encourage them to be out and about. And then some of our activities require that a medical staff member accompany a group that's going on a hike and is going to be any distance away from the main camp area or things like that. And they really appreciate the opportunity to be out and about with the kids.
Yeah. Yeah, I said this last night too. We encourage med staff to be involved, and we have a small enough camp that we actually can do that pretty easily, but it's a lot of fun to get to go on the tube with the kids. And I have tried horseback riding for the first time in my life at camp, so that was kind of fun to get to do. So, but definitely enjoy that. I think it's fun for the kids to get to see us in a different way than they normally do, and maybe even a little out of your comfort zone, because we ask them to do a lot of things out of theirs. So, okay.
Yeah, that's an excellent point. I think that one of the main joys for me always, and I know for a lot of our other medical staff as well, is that the relationship that you have with that child the next time you see them in the hospital setting is completely different. They see you as a human being as well as a doctor or a nurse or a child life worker, whatever else your role might be, and they feel much safer and know that you're on their side, and it makes a big difference.
Yeah, well said. Any other questions or topics that folks wanted to bring up? Well, I'll maybe take a minute to just ask a couple of thoughts. If we're going to move forward with doing these meetings to work on guidelines, work on the field guide, feel free to shoot me some thoughts about maybe how frequently you think we might need to meet. If it's something like a Zoom meeting like this, if it's going to be more dividing up into working groups, so we can make sure we're helping and being the most effective and efficient that we can be. So if you have thoughts, feel free to either put it in the chat or throw out an email to me. I'll put my email in the chat room so people have the contact if you don't already. Otherwise, Matt, do you have poll you need to launch? Be respectful of people's time here so that we don't take up any more than we
Just,
need
of
to.
course, unmute myself. I do have the poll, as well as I just also added to the chat the link to the evaluations. I'm also going to share your reminder, and then I'm going to launch the poll as well.
Oh, and I just realized I apparently can't type my own email today. I will put in a correction. Sorry about that.
Yeah, I was about to say, wait a minute, that's wrong.
Yep. Sorry. You
All
know,
right.
like I said, between the blizzard and technology, it's been an interesting Wednesday. There we go.
I was so impressed, Kay, with how fast you were typing.
You know.
So I launched the poll. If you'd be so kind as to just fill out your quick response, that'd be great.
And thank you so much, Dr. K, and everyone for all your participation today. Like Matt said, please feel free to take the poll, and don't forget about this evening's panel with the Future Camp panel with Bob Ditter, Dr. Ralph, Chris Fox, and Travis Allison. And that is another credit that you'll be able to get with that too.
That's 5 o'clock Eastern time. Is that correct?
5 o'clock. Yep.
Okay. Thank you, everyone.
Awesome. Thank you.
Thank you.
Thanks, folks.